In this video, I'm going to talk about how the newspapers in Singapore talked about cesarean section in the 1980s and 90s. In a previous video, I talked about how in the 1950s, the main discourse around cesarean was about its dangers, while in the 1970s, it was more about concerns that the rate was rising, although it was still very low at 6%. In the 1980s, we see that this was a period of public education. So newspapers gave a lot of information about the surgery. As we can see in this article, why the cesarean section needs to be done, which appeared in the Straits Times, 11 January 1984. A cesarean section, an operation in which a baby is delivered through an incision made in the abdomen and uterine wall, is sometimes requested for social reasons. That means not medical reasons. When is it really needed and how is it performed? Here are answers to the more commonly asked questions about it. The Night of the Long Knives is an infamous night in history, and some would say that history is being repeated every night in the obstetric theatres. The cesarean section, no doubt, is an operation that has allowed many babies to be born in peak condition, whereas if left to nature, they would have perished. But critics say that some of the cesarean sections are being performed on equivocal indications. What is a cesarean section? The cesarean section is an operation to deliver a baby through an incision made in the abdomen and uterine wall. The operation is said to be named after Julius Caesar, the Roman emperor, who, according to legend, was born in this manner. Ancient history, however, does not record this as a fact, and Julius Caesar probably was born in the usual style. Medical historians are unable to determine why the operation is called cesarean section. Of the uterus is called the upper segment. This upper segment is actively involved in the process of uterine contractions, the muscle fibers of the upper segment contracting and relaxing during the process of labor and during the process of involution when the uterus grows smaller after delivery until it reaches its pre-pregnant state. The lower half of the uterus is called the lower segment. This lower segment is passive in the progress of uterine contractions, allowing itself to be stretched and dilated. The lower segment than the upper segment. The classical cesarean section is an operation in which the uterus itself is opened with a vertical incision in the upper segment of the uterus. This operation is seldom performed nowadays as the uterine incision is more bloody and may not heal well. The operation that is most commonly performed is the lower segment cesarean section, often referred to by its initials LSCS, or C-section. The opening of the abdomen may either be midline or transverse. The midline abdominal incision runs downwards from below the umbilicus to the pubis. I think there's a picture here. So this one. And then this is the bikini incision. The transverse incision, also called the bikini incision, is made low in the abdomen just at the hairline. So here they write, why is a cesarean section operation performed? Indications for cesarean section: fetal distress, cephalopelvic disproportion, meaning cephalo, the head of the baby, pelvic, pelvis of the mother. In other words, the baby's head is too big for the pelvis. No progress in labor, breech presentation, uterine inertia, incoordinate uterine action. These two refer to a pattern of contractions that is not good. Cervical dystocia, failed induction. Okay, that one is not the mother's fault because who did the induction? Unfavorable cervix. Again, a very interesting diagnosis. Previous cesarean, previous myomectomy. Intrauterine growth retardation, meaning the baby is small for its gestational age, or social indication, which could be a number of reasons such as previous sexual trauma or rape, or fear or phobia of delivery. Now, for the first few reasons, fetal distress, a machine called a cardiotocograph will be measuring the heart rate of the baby. This machine was introduced in Singapore in the 1970s. And you see that this technology has created this condition called fetal distress. They give a lot of description here about how the machine is used. The gut ring external transducer is used. It is strapped to the mother's abdominal wall. It senses the uterine contractions and produces a trace on the chart. If the baby's heart rate is slower than 120 beats a minute or faster than 160 beats a minute, this may be interpreted as fetal distress, so too slow or too fast. Irregularity of the fetal heart rate may be even more ominous. An acceleration from a normal baseline heart rate is safe, but a deceleration may be bad. If the deceleration coincides with the contraction or recovers rapidly, okay, this is okay, a lot of information, never mind. So they explain every single thing that they listed. Maybe you can just pause to read if you want. But I'll just focus on the fact that this technology of the cardiotocograph, CTG, was introduced. And I think in this article, they try to focus on that as well because it's a new technology. Here, social indication. During the process of normal vaginal delivery, the vagina is stretched to allow the baby to come through. Some women feel that they should not let the vaginal distension occur as this will increase the size of the vagina and thus reduce their sexual function. They prefer to deliver by cesarean section. The social indication for cesarean section is not medically sound because, in spite of all the measures to increase the operation safety, statistical evidence shows that a vaginal delivery is safer than cesarean for the mother. Unfortunately, this reason is still common. Today, I've heard it among some Chinese women in Singapore, but here in the 80s, they very clearly said that it is not medically sound. That was in the 80s. So it seems that this was still a reasonable request. Compare that to today, where it's quite hard, especially if you're a subsidized patient, to attempt a VBAC or vaginal birth after cesarean. How long should you wait after a cesarean before having another baby? It is commonly said that you should wait 2 to 3 years, but I believe that 1 year is perfectly adequate to allow a woman to recover completely and be ready for another baby. How many cesareans can a woman safely undergo? Theoretically, there is no absolute limit. 6 to 13 are not too uncommon in Latin America. With the common objective of a small family in Singapore, it is usually safe for a woman to have three, provided she's closely monitored by her doctor. So 1984, there were some family planning programs here. Right in this period, they encouraged those who were rich to have more children, and they discouraged the poor from having more. And here you can see that this was a community service project of the Singapore Medical Association and the Straits Times, providing very comprehensive information for the general public. This is a diagram of the cardiotocograph. And I mean, knowing what I know now, the research I've done on CTG, I think I'll link to one of the studies. There's one study by O'Bladen where he said that the CTG caused a rise in the cesarean rate actually because of the creation of fetal distress. Then they provide some diagrams down, then in the uterus, then because they make a few cuts, right? So this is the cut in the uterus, that is the cut on the abdomen, that's the midline incision, then bikini or LSCS. Diagram of a vaginal exam. This is a diagram of an X-ray. I'll link to another video I did before, which was that X-rays were commonplace in the 80s, and then very soon after that, they realized it was dangerous, and then they started using ultrasound instead. Many opt for cesarean for wrong reasons, say doctor. So going back to the social reasons, Dr. Maureen Sakok is a doctor of ONG. She said many pregnant women believe giving birth this way would be less painful. Mistaken ideas. The belief that the operation is painless is only partly correct, she said. The healing process from the operation can be painful and inconvenient for 45 days. It can even be worse than natural childbirth. Also, there is no proof that the sex life is any different after natural childbirth, she said. There should be no difference if the mother takes good postnatal care. She pointed out that the risk of the operation is 10 times greater than having a baby naturally. The advances in our medical care facilities should enable most women to go for natural birth. Although Asian women are petite, they have comparatively large hip bones, which make it easier for them to give birth than most Western women, she said. That's so funny because I've heard private doctors say that Asian women have small pelvises. So it depends on the argument you're trying to make. I guess you can skew it either way. In public hospitals, about 10 to 12% of births are by cesarean, so which is double the amount. Oh no, this is public hospitals. So already in 1988 compared to 1974, this is about 15 years later. The rate has doubled from 6% to 10 to 12% in the public hospitals, and she added the figure may be higher at private hospitals. Most government hospitals charge more for the operation than the natural childbirth, she said. She thinks the same amount should be charged regardless of the method of birth. 1989. Cesarean, easy way for some. Some women are choosing cesareans over natural childbirth without any medical reasons. They do this knowing that the cesarean is more dangerous. 8 obstetricians in private practice said. A cesarean is not recommended unless the mother's or baby's life is at risk. It usually involves putting the mother to be under general anesthetic and then making a cut on the woman's abdomen and womb to take out the baby. In the 80s, yes, they used general anesthetic because the technology for epidural anesthesia was not advanced yet. Although they were using epidural for natural childbirth, I know in the 80s, but I'm not sure why it was not used for cesarean yet. Babies are getting bigger because mothers eat better during pregnancies. At the same time, women are getting taller and slimmer, said a specialist. Proportionally, it is more difficult to give birth, so a cesarean is seen as a major option. Some doctors want to save time. When a doctor has an average of 2 deliveries to perform a day, he cannot afford to wait for his patients to be in labor for more than 8 to 12 hours. And some doctors also want to play safe. A failed normal delivery could end up with the baby being deformed or weak. They provide a diagram that in normal birth, the baby comes out of the vagina. In the cesarean birth, the baby comes out through the belly via the surgeon's hands. In 1982, now we have some information about what's going on in the private hospitals. The number of operations performed last year rose by 9.7%. Now, in 1981, cesarean rates range from 11% to 16%. These are the two private hospitals. Then we have, that means the government average is about 13%. In 1989, natural birth is safer because the rate of cesarean is rising now. So part of this public education is to inform the public that even though cesarean is getting more popular, it should not be a trend, and that women should not choose it unless they have a medical reason, not a social reason. Very few doctors would go ahead and do a cesarean just because a patient asked for it. One said he talked his patients out of it, while another said he would give in depending on the patient. Cesareans are more risky. The mother risks bleeding, infection. A 29-year-old mother who had a cesarean 11 months ago wished she could have given birth naturally. Hers was done after 4 hours of labor. She had high blood pressure and there was fetal distress. It's very painful, like stepping on a needle. But there's nothing like going through the joy. Okay, so that's it for this video. We were looking at what was going on in Singapore in the 1980s, which was that the cesarean rate was still rising. So there was concerted efforts to educate the public through these kinds of articles in the newspapers.